Hello and welcome to the Bladder Cancer Advocacy Facebook premiere. My name is Stephanie Chisholm and I'm the Director of Education and Research here at Beacon. I'm joined today by two of our members of our bladder cancer community, Dorothy and John de la Garza, all the way from Texas, from Austin, Texas. It's a pleasure to have you with us today, Dorothy and John.
Thank you for having us. It's been 4 years since my diagnosis, and I'm glad Beacon's in our life.
Well, we love having you here. So, Dorothy, let's start with you first. Can you tell us a little bit about your diagnosis? You know, you mentioned 4 years ago. What was that like to hear that you had bladder cancer? What was your diagnosis? Had you ever heard of bladder cancer before your diagnosis?
Well, 4 years ago, after my parents had died of colon cancer and pancreatic cancer, I had no knowledge of bladder cancer, believe it or not. And my urologist was stunned also. And I think probably it's because women are so late, because so many other conditions mimic or confuse physicians, and they think, oh, it is UTI, oh, it's hematuria, oh, it's menopause, overactive bladder. So I was diagnosed with T2 muscle invasive, and it was a stunner. And I just wished I'd had more preparation.
Sure. John, that must have been pretty scary for you as well, as Dorothy was trying to get to having an actual diagnosis.
It was a pretty grim situation. We were on pins and needles for a while, waiting for the final outcome of all the testing. And I, as I tend to do sometimes, I heard it, quickly sort of 50% absorbed it, and then went into what is called my Superman mode, saying, okay, what are we going to do about it? And literally was on the phone within 2 or 3 hours after diagnosis to find an expert who could take us farther.
Well, that was great that you were able to do that. So you obviously have had a number of different treatment options along the way. And now where are you with your diagnosis? What's going on?
Well, after chemo and then the surgery, followed by many complications, which again, I don't think bladder cancer patients know in advance how many complications can come after surgery and chemo. And so we're now on a good path. I have an excellent doctor at UT Dell Medical School, University of Texas Dell Medical School.
Here in Austin.
And that makes all the difference, because I feel like we're on the path that is up to date, research based, as well as patient oriented.
So you're saying you've got a great doctor who's got a lot of experience. What would you tell other physicians that might not really understand what's going on with bladder cancer patients, especially as they progress in their disease or they have a very advanced diagnosis? What would you want other bladder cancer physicians to know from that patient experience?
From a patient experience, I wish they would treat me more as I treated my students when I was teaching. Don't talk down to the patient. I know the doctors all have a lot of scientific information, but they need to assume that I want to know where my journey's going, what the treatments involve, and give me details so that I don't end up Googling instead of knowing from the doctor's own perspective what to expect.
Mm-hmm. Absolutely. Sometimes going to Dr. Google might not always be the best resource. So what has been the most difficult thing that you found to discuss with your physicians? Have there been any challenges for you as a patient in bringing up issues with your doctors?
I'm pretty direct with my doctors. I think the most difficult thing is to coordinate the various physicians that you have, your urologist, your oncologist, your hematologist, your anesthesiologist. It's a whole bunch of ologists, and to coordinate them is sometimes difficult, and they're not always on the same page. My urologist said, get that bladder out immediately. My oncologist said, no, you need to have chemotherapy first. Thankfully, she knew what the NCI protocols were, and he was very happy to learn them.
Mm-hmm. So it sounds like you needed a appointment keeper and a secretary. Was that your role, John? How did you
Yes.
fall into all of these ologists? What role did you play in helping keeping Dorothy on time for all of her appointments?
Without actually having her diagnosis, I sort of wanted to take the role of having a diagnosis like that and being the best possible support I could be, which meant, and fortunately, we're in a situation where I am retired, and I was retired at that point. I had the time, I've got the intellect to do it, and I've got the interest to do it. So I just went to every appointment, took notes, coordinated those notes with her, following the visits, at the visits, and at the visits too, if I had a question, I sort of insisted on being able to ask that question of the physicians. We were extremely fortunate in finding the surgeon who did her radical cystectomy. He is a good soul and happens to be also a Beacon researcher, which is even better. But he allowed that kind of conversation among the three of us, and in fact, encouraged us to know as much as we possibly could about what he was about to do in the radical cystectomy surgery process, which was robotic and a long one.
Sure. So what advice would you give to another caregiver who was trying to help their loved one go through this journey?
Find Beacon as soon as possible for all sorts of reasons. There is so much information written and on the web, Beacon sponsored, that allows you just to really enter that world of bladder cancer and understand it almost on a recipe step-by-step basis. It's not overwhelming, but it requires interest, it requires study, it requires time. But that time is extraordinarily well spent as the process continues.
Mm-hmm.
And frankly, if we had found Beacon earlier, I would have been a lot more relaxed. My questions would have been better, and we would have known what to expect a lot sooner. Beacon was a breath of fresh air and support for us being intelligent questioners. We could question our doctors based on what we'd read from Beacon.
Looking back, there's another little wrinkle here too, if you will. We happened to be introduced 2 or 3 days before Dorothy's surgery to an extraordinarily WOC nurse who really talked to us about some other things that we would have not found out about until later. Number one, she recommended the brand of appliances that Dorothy uses. 2, she told us, or she helped Dorothy locate where the ostomy would be, and quickly told us, don't let the doc do it, let a good WOC nurse do it, because we know what the body is like and we know what to look for and where to place it. So that was another little incremental bit of knowledge. Mm-hmm. And we have come now to depend upon a retired WOC nurse here in Austin for continuing by advice and counsel. And she even works with photographs. So we have this.
He can do a stoma shoot.
I do a stoma
of
shoot.
My body. It's really very, very fashionable. And then get a quick diagnosis, which is even, I mean, with COVID, it's been interesting because he can't go into a lot of the appointments with COVID. So he listens in on his telephone, and the doctors turn their cell phone on too. And so we never let COVID shut him out.
That's really good advice, because we don't know when this whole COVID is going to change. But let's just go back one big step, because I think it's important. A wound and ostomy care nurse is what you're talking about with the WOC, correct?
Yes, correct.
I just want to make sure that our listeners are aware. And most institutions have somebody who does specialize in helping that physician find the best way for a urostomy to fit into that patient's life. They should take a lot of things into consideration. I know that you probably had some questions about it, and I'm sure that that nurse was very capable about explaining where they recommend that your ostomy go, which is what happens when you have a urinary diversion. When your bladder is removed, there's oftentimes a urostomy that's placed with a stoma in your body, and that urine is caught as it leaves your body in a bag, and you just have to empty the bag. So it's not a huge problem. It just needs to have a little forethought to go into it, correct?
Yes, and once you understand the process, then in the aftermath of all of this, it's just something else that's done every day. It's part of your routine. And if you allow it to be a part of your routine in a positive way, quite frankly, it's not a big deal.
Except it is a big deal when you're first starting out, because let's face it, your body has changed. You now have a bag for the most part outside. You can have a needle bladder inside too, but it is a change in your body. And fortunately, he made me feel that I was still a beautiful bag lady.
Yeah, I think that's a real challenge that many of our bladder cancer community patients who had to have a radical cystectomy where their bladder's been removed, we refer to it as the new normal. It is different, but it is a new way of going about everything that you do. You have to account for that. And I think that's a big consideration that many people are not prepared for. And it sounds like as a team, the two of you work really well to make sure that this is not necessarily slowing you down there in Austin, correct?
Very correct.
No.
And it's, again, Beacon continues to play a beautiful information role in putting together patient-to-patient conversations, caregiver-to-caregiver conversations, where we can, as now pretty experienced with this, in a positive way, offload this information, this caregiving with ease to other folks who are beginning the same process that we started more than 4 years ago.
Right. You're talking now about our Survivor to Survivor program, which is a wonderful way to match somebody who really is a little bit anxious about what journey they're about to go on with somebody who is experienced, who's gone through it. And that individual like you, John and Dorothy, can share that kind of information about, hey, these were some questions I wish I had known before I started down this path. So those are some really great resources. And I appreciate that you're mentioning a lot of Beacon resources as being helpful. What are some of the things that you could just share that were really helpful to you that you found with Beacon?
I wished my doctor had given me at the diagnosis the Beacon handbook with all of the diagrams, all of the potential protocols, all of the medical knowledge in a handbook. Instead, my oncologist gave me a thick general cancer book, which was fine, except it did not reflect bladder cancer specific issues. And so I really do wish every doctor, whether it's your general practitioner, urologist, oncologist, had access to what Beacon puts online and prints for the patient to know about not only their body, but all of the various treatments and complications. I think we keep forgetting complications follow. Even if you're cancer clear, you just know you're going to have complications. Sorry, but that's the fact of life.
Well, that sometimes does happen, I know. And you're referring to our Bladder Cancer Basics, which is a document that's really plain language, easy to read for patients who might be newly diagnosed or patients who might have any kind of progression of their disease. And you can get free copies of that by visiting us at bcan.org and looking for handbook in the search feature, and you'll find it, and you can download one or you can request that one be mailed to you. So thank you for promoting that. I think it's a great resource, and I hope more people are able to access it and be able to use it. So stress and anxiety of having this diagnosis. What advice do you have, Dorothy, as a patient, and then John, to help others cope at the beginning of their journey with some of the stress and anxiety that comes along with it?
Well, in my case, I was teaching middle school students right before my diagnosis. And the best thing that happened to me was to go into the chemotherapy, go into the surgery, and keep on teaching. So I kept a purposeful life at the same time I was undergoing treatment. It'd be great that you not spend 24/7 dwelling on your diagnosis, but actually stay involved with life and your responsibilities, and hopefully have a caregiver. I mean, some people call them caregivers. I call them caregivers, because if it's not a partner, a family member, friends along the way make a difference. And that's what reduced my anxiety. I could vent to him, and then he would say, "Don't worry, we'll take care of it."
You know, Dorothy, you remind me of absolutely one of my favorite sayings. It's been my mantra for my whole life, and I think it's really important. Joys shared are doubled, burdens shared are halved. And I really get that sense from the two of you, that whatever little joys you have in advances that you receive in care, you both share in those joys, and then the burdens are shared equally. So John, you know, what is your advice? What would you tell another person who's beginning to help their loved one along this challenging journey?
Many years ago, oh gosh, now 50, 56, 57 years ago, when I entered the Air Force, there was a saying, and I suspect it's still used, that your altitude determines your attitude. Attitude is everything, just simply everything. And it's not always easy to keep a good attitude, but the more you try, the more you can be around some folks that will help buoy you up. Keep your attitude good, go into it. It's not just a little wrinkle in life, but it's another wrinkle in life. And life has lots of wrinkles. You just tackle it, you just do it. Be a friend to someone. Let the someone be a friend to you, even outside your marriage, outside your partnership, so that your attitude stays there and stays good, so you can continue to help the person you love, the person you want to help the most, help that person get through the diagnosis, get through the treatment, get through everything, and continue on with life as best you can. There are no guarantees, but the more you look at life positively, the better the guarantees may seem to be.
Well, I like your analogy of saying, you know, another wrinkle in life. And obviously, you know, the longer you're around, the more you end up with a few wrinkles, but they're not
Yes.
necessarily wrinkles. I'd like to think of them more as character lines.
Yes, they
And
are.
I do think that, you know, this experience of having bladder cancer is one that over 83,000 people are going to be diagnosed with this year alone. And it can be really scary, because for most of those patients, this will be the first time that they ever learned that you could even get cancer in your bladder. And, you know, it is a challenging journey. I am really grateful for you all to, you know, what you're sharing is helping remind people that having a little sense of humor in some of this, and then attitude, really helping to drive your altitude in terms of how you're handling everything, is a big deal. This has been phenomenal. I greatly appreciate your sharing. Any last thoughts or advice?
I have a bit. If one becomes involved in a good way, in a good way with Beacon, there is so much to be learned. I am so impressed with the Beacon process of ensuring that researchers and docs hear from patients in a very real, direct way, unfiltered. The patients need to understand what's going on medically, and the medical side of life, particularly the researchers and then the practitioners, need to understand how what they're doing really affects the lives of bladder cancer patients. The two-way conversation is remarkable, is refreshing, is genuine and is so helpful.
And
Thank
on a personal note, just during the Beacon Walk this year in May, my 12-year-old granddaughter said, "Grandmother, explain to me why your team that's walking for Beacon is called ATX Bag Lady." And I don't take my grandchildren in to the bathroom with me, and I didn't take her in, but I did explain to her that grandmother no longer urinates the same way she or her brother do, that grandmother has a bag and that she empties her bag, which means that's why I'm the bag lady. And she never said, "Show me your bag." And I didn't, but I feel like after I explained the bladder and the whole kidney and urinary process, that she felt like she was very much grown up about it. It was a wonderful moment explaining bladder cancer to a 12-year-old.
I think it puts it in perspective for them because they're curious. Why are we doing all of these things? And to help them understand you better and what you're going through. So thank you for doing that. It's really challenging. I know that for a lot of people, they don't realize that, yes, you can live a very full and active life, even without a bladder. So thank you for conveying that message. I think it's really important. And I'd like to thank you both so much for joining us today for our Facebook premiere. And everyone who's listening, please visit bcan.org for a lot more information and resources. We're open 24 hours a day, 7 days a week online, so that you can get what you need, even when you have one of those, oh my goodness, moments at 2 o'clock in the morning. Visit our website. There's probably an answer there. So thank you, Dorothy. Thank you, John.
Thank you, Stephanie.